Alzheimer's disease. It's a condition that affects millions of people, but honestly, it's often surrounded by a lot of confusion and uncertainty. So in this explainer, we're going to try and cut through all that noise. We're going to break down what Alzheimer's actually is, how it affects the brain, and what that journey looks like step by step. So let's kick things off with a number that really shows just how widespread this is. Dementia, with Alzheimer's being its most common form, affects roughly 1 in every 14 people over the age of 65. And that number, it jumps to 1 in 6 for those over 80. So this isn't some distant issue. It's a huge health challenge that touches countless families and communities. Okay, before we dive any deeper, it is absolutely crucial that we get this out of the way. All the information we're about to cover is based on NHS guidelines, and it's here to help you understand the topic better. But, and this is really important, it is not a substitute for professional medical advice. If you have any health concerns at all, please consult your GP. All right, here's our game plan for this explainer. We'll start by defining Alzheimer's, then we'll take a look inside the brain, trace the journey of the symptoms, and then cover how to reduce your risk, the path to getting a diagnosis, and finally, what it means to live with the condition. Let's get right into it. Okay, first things first, the fundamentals. Alzheimer's disease is the single most common cause of dementia, and it's really important to get this straight. Dementia itself isn't one specific disease. Think of it more like an umbrella term for a whole collection of symptoms that are all caused by a decline in brain function. So what's the actual difference between Alzheimer's and dementia? Here's the key distinction. Think of dementia as the syndrome, the visible symptoms like memory loss and confusion that you see on the surface. Alzheimer's, on the other hand, is the specific progressive disease that's actually causing those symptoms. Getting that distinction right is absolutely fundamental to understanding everything else we're going to talk about.
Right, so now that we've got the definitions down, let's go from the what to the how. What is actually physically happening inside the brain of someone with Alzheimer's? This is where we get to see how the disease causes damage right down at a cellular level.
Okay, at the very heart of the problem, you've got these two key proteins, amyloid and tau. An abnormal buildup of these two is what really drives the disease. And here's a simple way to picture it. Amyloid forms these sticky plaques, almost like roadblocks between the brain cells. Tau, on the other hand, forms tangles, which are more like transportation snarl-ups inside the cells themselves. Both are bad news. And this shows that chain reaction perfectly. It all kicks off with that abnormal protein buildup we just talked about. This leads to those plaques forming between the cells and the tangles forming within them. From there, the communication between brain cells just breaks down. The cells themselves get damaged, and over time, this causes the affected areas of the brain to actually shrink. So that's the microscopic damage happening inside. But how does that translate into the real-world symptoms a person actually experiences? Well, Alzheimer's is a progressive condition, and what that means is the symptoms develop really gradually over many years, and they become more severe over time. Now, to make sense of this progression, experts often break the symptoms down into 3 general stages. You've got the early stage, the middle stage, and the later stage. This framework is super helpful for tracking how a person's abilities change and figuring out what kind of support they might need along the way. So, in that early stage, the signs can be pretty subtle. The main one is usually memory lapses. Someone might forget a recent conversation or misplace their keys more often. You might also notice them struggling to find the right word, or maybe asking the same question over and over, or just seeming a bit more indecisive than usual. Okay, as the disease moves into the middle stage, the symptoms become much more obvious. Memory problems get worse, sometimes to the point where someone might not recognize close family members. They can become really confused and disoriented, even in places they know well. This is also when you might start to see more obsessive or repetitive behaviors, problems with speech, or big changes in their mood or sleep. At this point, daily support usually becomes pretty essential. Then, in the later stages, the symptoms become very severe, and the physical impact is much clearer to see. Someone might have real difficulty moving around, and even eating and swallowing can become a challenge. Their speech can be gradually lost, and both short and long-term memory are significantly impaired. At this point, they'll need full-time care to help with pretty much all aspects of daily life. Okay, after talking through that progression, it's totally natural to ask, well, what can we do about it? And that brings us to a much more empowering part of our guide, the proactive steps you can actually take to help reduce your risk of developing dementia. Which, of course, leads to the big question, can you actually prevent Alzheimer's disease? And the honest answer, based on the science we have today, is there's no guaranteed way. We still don't fully understand exactly what causes it, But, and this is the really crucial part, research strongly suggests that you can significantly reduce your risk.
And what's so interesting here is that the advice for cutting your dementia risk is almost identical to the advice for keeping your heart healthy. It turns out what's good for your heart is also fantastic for your brain. We're talking about things like stopping smoking, cutting back on alcohol, eating a healthy, balanced diet, and staying physically active, aiming for about 150 minutes a week. And of course, managing things like blood pressure, cholesterol, and diabetes is key. And it's not just about your physical health either. There's a lot of evidence that shows keeping your brain active and challenged is also really protective. Think about people who stay mentally and socially engaged, maybe by reading, learning a new language, or playing an instrument, or even just volunteering and maintaining an active social life. These things seem to be linked to lower rates of dementia. So what if you, or someone you know, is worried about memory problems? What happens next? Well, this next section is all about demystifying that path to getting a diagnosis. It's really all about seeking clarity and getting access to the right kind of support. So, the journey usually kicks off with a visit to your GP. They'll do some initial checks and ask questions, mostly to rule out other things that can cause memory loss, like stress or even some vitamin deficiencies. If they think Alzheimer's could be a possibility, they'll refer you to a specialist for more detailed tests. And from there, that can lead to a formal diagnosis and, really importantly, a plan for care. That referral is usually to what's called a memory clinic, and there you'll see a specialist. This could be a psychiatrist who focuses on mental health, a geriatrician who's a physician for the elderly, or a neurologist, an expert on the brain and nervous system. They all work together as a team to do a really thorough assessment. So what do those assessments actually involve? Well, often they include what are called cognitive tests. These are basically a series of pen and paper tasks and questions that check things like memory, language, and problem-solving skills. A specialist might also arrange for a brain scan, like a CT or an MRI scan, to look for any signs of damage, or to rule out other possible causes, like a stroke or a brain tumor. You know, getting a diagnosis is a really pivotal moment. It opens the door to our final section, understanding how people can live well with Alzheimer's using a combination of treatments, therapies, and really robust support systems. Now, it's super important to be clear about treatment. Right now, there is no cure for Alzheimer's, but there are medicines that can help manage the symptoms, often by boosting the communication signals in the brain. And alongside medication, therapies like cognitive stimulation can be really effective in helping people to maintain their memory and problem-solving skills for longer. And this right here is maybe the most important message of all. Living with Alzheimer's doesn't just affect the person with the diagnosis. It affects their entire family and circle of friends. The journey can be incredibly challenging, but there are huge support networks out there, from healthcare services to charities. The key thing to remember is that you are not alone. No one has to face this by themselves. And that brings us to our final thought. Look, understanding the science, the symptoms, and the treatments is absolutely vital. But all this knowledge kind of calls us to action, doesn't it? It leaves us with a big question to reflect on. How can all of us, as friends, as neighbors, as a community, do a better job of supporting those on this journey with dementia?